We have been on to this series now for nearly 3 years, and we have done about 210 odd webinars. We've been very, very fortunate when we started. We wanted a blend of domestic and global experts to come and speak on contemporary issues relevant both to India and the world. We've been very lucky that we have had that blend, and I'm happy to share with you that we have had three Nobel laureates come and speak to us. I can already see three potential Nobel laureates amongst us who have come and spoken to us and are speaking to us. And we have had so many speakers from across the world and India speak to us on contemporary issues. As you know, the Foundation for Economic Growth and Welfare is a research-oriented policy think tank established in NCR in October 2018. Our objective is simple: provide rich research-based policy advice to anybody who seeks from us, mainly the governments. We have been lucky in that sense. We've been working with the government, the Niti Aayog, different ministries, UNSCAP, and many other agencies we have been working with, doing research, providing inputs. We have been also engaged with lots of working papers there on our website. You can have a look at that. And all of us have made an endeavor that contemporary policy issues need to be thought through, lots of research to be done before making a policy advice. Once COVID set in, we took this recourse of webinars and bringing in now the policymakers and the academicians, bringing them together to discuss various issues. We were fortunate to work for G20 under different schemes. The one of it that we did a complete series was New International Economic Order. We did about 12 webinars. Then we also worked on climate. We have done about 6 of them. And then we looked at women empowerment. We have done about 8 of them. Today's issue, as we all would agree, is an extremely important issue: poverty. In our country, many elections have been fought in the past on poverty eradication. Recently, we have had rich data released on poverty. In the meantime, multidimensional poverty index has come. Professor Sabina from London, she's an expert on it. Taking her advice, we have prepared one in our own country. Traditionally, Professor Nanak Kakwani, who was my professor when I was doing my PhD in Sydney, has been a tall figure in the area of poverty estimation. So today we decided to have Professor Kakwani with us, and he'll be with us next Friday too. And because today he is going to touch upon the multidimensional poverty, we invited Professor Sabina to please join us. And I'm so happy to tell you that she had a very busy time. She is in Washington today. It's 5 a.m. up there, and she agreed to join us. That shows the commitment the academic world has to policy advice. Who could have chaired this session? We have Dr. Arvind Virmani, who himself is been into policy making for many, many decades, and he is known across the world for his policy work as well as research. He has published work, he has books on it, he has been with the erstwhile Planning Commission, he has been at the forefront while the reforms were being undertaken in our country. So we decided to have Dr. Arvind Virmani to chair the session. Before, before I hand over the session to Dr. Arvind Virmani, let me briefly introduce the three speakers, and then I'll hand it over. Dr. Arvind Virmani right now is working as member of Niti Aayog. He's the former chairman of the Foundation for Economic Growth and Welfare and president of the Forum for Strategic Initiatives. He has been a mentor to FICCI and a member of the RBI Technical Committee Advisory Committee on Monetary Policy. He was earlier the executive director at the IMF, chief economic advisor of our country. He was the principal advisor in the Planning Commission, and he has also been in another think tank, which is the Indian Council for Research on International Economic Relations, as director and chief executive. He has published 35 journal articles, 20 book chapters, and written over 50 other working papers in the areas of macroeconomics, growth and finance, tax reform, international trade and tariffs, international relations, and national security strategy. Our key speaker today is Professor Nanak Kakwani. He's the Distinguished Fellow of the Gulati Institute of Finance and Taxation in India. He has been visiting professor of economics at the China Institute for Income Distribution at Beijing Normal University, China since 2017. He was a professor of economics and head of the Department of Econometrics for 30 years at the University of South Wales, New South Wales in Sydney, Australia. I was his student up there. He was chief economist and director of the UNDP International Policy Center for Inclusive Growth in Brazil. His Professor Kakwani's research areas include poverty, inequality, pro-poor growth, taxation, public policies, human development, and social welfare. He has published more than 100 papers in leading international journals and 6 books published by reputed publishers like Oxford University Press, Cambridge University Press, Palgrave, and Edward Elgar. He was elected as a fellow of the Australian Research Committee of Social Science and was awarded the Mahalanobis Gold Medal for outstanding contribution in quantitative economics. His well-known Kakwani Index has been a standard measure for progressivity in taxation and other social sciences. Our discussant for the day is Professor Sabina Alkire. She is the Professor of Poverty and Human Development and directs the Oxford Poverty and Human Development Initiative at the University of Oxford. We are very fortunate to have her second time on the EGROW webinar series, and we are obliged to her. We thank her for that. She worked at the George Washington University, Howard University, the Human Security Commission, and the World Bank. She is a DPhil in economics from the University of Oxford. Together with Professor James Foster, Sabina developed the Alkire-Foster method for measuring multidimensional poverty, a flexible technique that can incorporate different dimensions or aspects of poverty to create measures tailored to each context. With colleagues at OPHI, this has been applied and implemented empirically to produce a multidimensional poverty index at various places. India is one of them, and we have followed it consistently. The MPI offers a tool to identify who is poor by considering the range of deprivations they suffer. It is used to report a headline figure of poverty, which can be unpacked to provide a detailed information platform for policy design showing how people are poor nationally and how they are poor by areas, groups, and by each indicator. Sabina was elected as a Fellow of the Academy of Social Sciences in the UK 2021 and was voted one of the top 100 thinkers by Forbes magazine in 2010. With this brief introduction of the speakers, I now hand over the session to Dr. Arvind Virmani to take the proceedings further. Sir.
Thank you, Charan. I usually start the process quickly, but like Charan mentioned, I've been involved in poverty in one way or another, I don't know, since the 1980s. So I'm just going to say a few words from my experience. You know, as an old man, I now tell young audiences that I have a kind of a right to give some of my experiences, but very quickly. So from 1960 to 1990, we had this concept of poverty alleviation. I think India was the first country in the world, actually in the 1960s, to kind of invent this word or start talking about it at that time. So I started to take a look at this in the 2000s and we did some calculations, and we found that with the budget of the top 3 poverty alleviation programs in the world, in India, if that was given directly to the poor, we could eliminate poverty. So I started talking about poverty elimination in the 2000s. And as part of that development of how to go about it, of course, I wrote a paper in which I gave these estimates, but it was also, so the one problem which arose immediately is how do you identify who are the people you'll give this money to? And that is when I came up, started thinking about the concept and also mentioned it in that paper of the UID, the unique identity, which would then be used for all poverty elimination programs, so to say. The interesting variation of that, before I hand it over to Professor Kakwani, was that I also found the data on hunger, which nobody had looked at that time. So I looked at many different aspects. I got some studies done by outside institutions. One of them actually identified that poverty was concentrated in the heartland, so states which are far from the periphery. But one of the interesting things which also emerged during my investigations at that point was there was actually a question on hunger in all the previous consumption surveys. Okay, so I dug this out and found an incredible result, which maybe I'll hold for later. But it turned out there was a state in which hunger was 3 times that of the poorest state which we were talking about, and it was less than about 2% at that time. Anyway, with those kind of preliminary words, I should also mention then, of course, in the 2000s and later, we do have an expert, and I look forward to hearing from her. Then people started criticizing this index, the poverty measurement, and started talking about the multi-dimensional poverty and these indices. So I hope to learn from that. But before I hand it over to you, Professor Kakwani, I must mention that I still remember having a copy of your book. I mean, Professor is a veteran. I mean, he's of the poverty much more than I was, of course, on the policy side mostly, and only focused on issues connected to policy. But I still remember looking at that book. I used to have it for a long time. Then somehow at some point, probably when I moved or cleaned up my house, it disappeared. But it is a pleasure to have you here, and I look forward to listening to you. Over to you, Professor.
Thank you, Arvind. Since you were, Arvindji, since you were talking about my book, the very old book, now the new book has come out, this one,
Okay.
Oxford University Press. The
Okay.
title is the same, Economic Inequality and Poverty. But it's very different from the earlier book. It has a lot of results, including a chapter on multidimensional poverty. Okay, so I think I have given the details to Dr. Charan Singh about this book.
Yeah, I'm glad you mentioned it. Yeah. Okay. Yeah.
Okay. Okay, so shall I start now? Yeah. Okay, let me tell you at the outset that poverty relates to many stories of human sufferings, human deprivation. In fact, I was brought up in India, so I was very much in Bollywood movies. I was used to watch Bollywood movies. And old movies, if you see, every movie, almost every movie, they were talking about poverty in Bollywood movies. Say, children are not able to get food, they go hungry, and then family cannot provide them. They go out on the street, and then they see many other people eating food in the dhaba, and then they steal the food, and then they are, beaten up and sent to jail or something like that. At home, the mother or father, they are dying, they are very sick, and they cannot get access to doctor, they cannot buy medicines, and then they die at home. So these are very telling stories, and Bollywood depicts these stories, I think, very nicely. Uh, that lot of, I mean, it covers a lot of, access to medical services, access to education, unemployment, and so on. There are many interesting movies in Bollywood movies. So having said that, now I move to next slide, please. Move to my presentation. Okay, next slide. Okay. Yeah. Let me take you back. Actually, I think, yeah, to 1901. The English economist Ronthree, he wrote a very nice paper. I think I still like that paper. And he provided a very systematic way of defining the poor. He defined family in primary poverty if their total earnings are insufficient to obtain minimum necessities of mere physical efficiency. So this was the definition he gave, Ronthree. So first he estimated the minimum money cost for food, satisfying average nutritional needs for families of different sizes. Then he added rent paid and specific minimum amounts of clothing, fuel, housing, and sundries to arrive at a poverty line of a family of given size. And and poverty line, so his idea was that poverty line is the total cost of maintaining the minimum necessities of merely physical efficiency. So a family is classified as poor if its total income from all sources is less than its poverty line. So I thought this is a very interesting definition, very precise and very sharp. I don't know how many people read that. Now, Amartya Sen, I mean, he was my guru. He called it biological approach, the Ronthree. And this approach may also be called the nutritional approach because it defines the poor as those who cannot meet their minimum nutritional needs. But I would call it basic needs approach. A person is poor if he or she cannot meet the socially accepted minimum needs, including basic food, non-food needs. So in Rounthree's poverty approach, basic needs included access to nutrition, nutritious food, adequate clothing, fuel, housing, and sundries. So he covers many aspects of this. But more recently, I have written a paper published in a book edited by Professor Jock Silber, 2011. I developed a model of poverty using the consumer theory. This approach allows families and households to satisfy nutritional and essential non-food needs, such as education, shelter, transport, health, and basic needs in this approach also includes transport, education, health services. So I also took account of the economies of scale which occurs in larger households. So this is a paper, but I just described quickly this paper, this interesting paper, because there's a lot of work, nutritional work in India. India was a leader of poverty measurement, and then they talked about nutritious food which meets the caloric requirements. But my idea was that when calorie requirement is one aspect, that you need some energy to survive, but also calorie cost. I introduced the idea of calorie cost. The calorie cost I proved that it is a good indicator of standard of living or utility, because I use the utility theory. So calorie cost is very important. That when poor people, they may consume, say, enough calories, 2000 or 2500 calories, but how they are getting those calories? If they are getting all their calories from carbohydrates, cheap food, right, then they cannot have a nutritious food, the well-balanced food. So you need proteins and other vitamins and so on. So to get, vitamins or proteins and all that, you need to have higher calorie cost. Because rich people may not consume too many calories, they may consume same as maybe poor people, but the cost of calories is very high in their case. For instance, give you an example that if you eat your food in a restaurant, your cost of calories will be very, very high. So cost of calorie is a very, very good indicator of households' standard of living. So that's what I just want to explain that. But so can we go to the next slide, please? Next slide. Yeah. Now, come to India's contribution to measuring poverty. I mean, as Arvind pointed out, that India was a leader in 50s and 60s in measurement of poverty. But even before pre-independence period, there was a lot of interest in India on poverty. For instance, Dadabhai Naoroji was the first person to discuss the concept of poverty line for India in as early as 1878. His view was that poverty line is not a precise concept, so he defined a person to be poor if per capita income was between 16 rupees to 35 rupees per year per person. He also suggested that person is poor if their food consumption basket diet did not include rice, vegetable, mutton, ghee, oil, and salt. Which means that he was aware that food people eat must be nutritious, and which includes calories and proteins. So that is interesting. I think that he defined poverty as early as 18. Now pre-independence period, Indian National Congress, they constituted a national planning committee under the chairmanship of Pandit Jawaharlal Nehru. So this committee defined in 1938, gave the development agenda for India. So this committee, identified the following social objectives: improvement in nutrition with a balanced diet having a caloric value of 2,400 to 2,800 calories per day for an adult worker. Improve in clothing from consumption 50 years to 80 years per capita, and so on, and reduction in elimination of unemployment, literacy, and life expectancy at birth. So you can see that this is all multidimensional poverty. I mean, this is not a unidimensional, that there are, at that time, they gave the very comprehensive concept of the multidimensional poverty. Although they did not define rigorously the multidimensional poverty, but the idea was there that poverty is multidimensional. And they gave a very comprehensive indicators of poverty. After independence, many committees were formed in India, and they talked about poverty. They developed the poverty lines. So the Planning Commission in India was the main body which was working on poverty. So its working group constituted in 1962 developed separate poverty lines of 20 rupees and 25 rupees and urban areas. Maybe I should escape all this, but the point I'm making is that there are so many studies, the Dandekar and Rath Planning Commission, and then you have a Alag Commission, and then Lakarwala, and then we have Tandulkar, my late friend Tandulkar. He can you move to next slide so that I can skip all that because this must be known to everybody. Hello? Okay. The Tandulkar, he became, he was heading an expert group on poverty, and he gave 3 recommendations. Poverty estimates should be linked to 1973-74 line basket of goods and services to reflect the changes of consumption patterns of the poor over time. And then he also said that poverty line should be adjusted for changes in prices of goods and services, both temporarily and spatially across the regions and the states, rural and urban, So these and basic needs must include expenditures on health and education so the poor can access health and education services. So these are the 3 very sensitive recommendations which were made by Suresh Tandulkar. But I don't know, I'm surprised that there were a lot of criticism in India about Tandulkar's poverty lines. And then there are other committees, Rangarajan committee, no? Let me skip that. So finally, I come to Niti Aayog report. On multidimensional poverty. This has attracted, now I find that Niti Aayog's the reports attracted a lot of attention. Yeah, so Niti Aayog's poverty line, it has been accepted and applauded. And I'm very surprised to see that a lot of many YouTube, they are teaching this poverty, multidimensional poverty index formulated by the Niti Aayog. And in public service examinations also, this topic has become very important, and they are talking about that and explaining, because there will be some questions in public service exams on this multidimensional poverty. So a lot of interest in this poverty and analysis. But how, the Niti Aayog moved to multidimensional, saying that income poverty is very narrow, and therefore, because people suffer in many dimensions of the poverty, so Niti Aayog moved to multidimensional poverty. But the little review which I have given you about work in India, Indian poverty, and starting with round 3, poverty was not very narrow. I mean, it was multidimensional, that they considered many aspects of poverty in many Indian studies. There were many many dimensions of the poverty they considered: health, education, and living conditions, and so on, clothing, food, clothing, and all that. So I think the earlier studies were not unidimensional. They were not very narrow, but maybe that now multidimensional poverty talked about by Niti Aayog, maybe more, it includes more capability deprivations or more dimensions of the poverty. So, but what is, the World Bank has a, international poverty line, 2015 and 2017 PPP. That is a very narrow poverty line because it is only focused on income, that low layers of income. So that I can say is very limited, but the Indian studies which were done from starting from pre-independence period until 2011, they were, they covered many aspects of multidimensional, many aspects of the poverty. So that should be noted that it's, multidimensional poverty is not a new idea. It has been there all the time, but maybe the conceptualization was not done that rigorously. Okay, can I move to next slide, please? Hello? I think. Okay. So how did multidimensional poverty become so popular? Now, according to 2000 World Bank Development Report, WDR, poverty is defined that poverty is the pronounced deprivation in well-being. The definition raises many questions. How is well-being defined? What are the elements necessary to ensure a decent level of well-being? These questions are not by any means easy to answer, but this economic literature in the 70s and 80s advanced many approaches to describe well-being. Vital are basic needs, economic growth, quality of life, utility, welfare, happiness. So these were the different, the ideas which were floating around. But these approaches do not provide a unifying framework to define well-being. But it was Amartya Sen in 1987, 1999, 1985 in many papers. He gives a concept of well-being, most comprehensive concept of well-being. He developed the idea of functionings and capabilities. Functioning is an achievement and capability is the ability to achieve. So according to him, functionings are directly related to kind of life people lead. In contrast, capabilities are connected with people freedom to choose the life they want to lead, which is their functioning. So according to Sen, the process of economic development must be concerned with what people can or cannot do or can be or cannot be. So this became a very, his work on functioning and capabilities and well-being is the most outstanding work. And it was noted very, by UNDP and, all international organizations. And inspired by his work, the Human Development Index was developed by UN. It came up with the Millennium Development Goals afterwards, MDG, and then Sustainable Development Goals. So since 1985, seminal work on functioning and capabilities had been the most influential in defining well-being and developing the UNDP Well-being Index. Now these aggregate indicators, they shifted the emphasis from economic growth, the growth rate of GDP, to well-being. So that was a big change and created awareness for well-being and away from economic growth. Now, these well-being indicators have been widely used to compare well-being across countries and over time. The UNDP set goals that have been crucial in monitoring human progress in worldwide. Now, almost all United Nations member countries, they have adopted Sustainable Development Goals. And they also presented many conceptual and measurement challenges, SDG. The main problem I see in Sustainable Development Goals is that they ignore the distribution of well-being across the population. They are more or less the average well-being. They talk about the indicators are all average well-beings. Maybe one or two, poverty and inequality, they are not purely average indicators, but mostly the sustainable development goals ignore completely the distribution of well-being across the population. But multidimensional poverty measurement poses different kinds of challenges, which I plan to address in this presentation. I distinguish between multidimensional poverty and sustainable development goals. So this distinction is critical in formulating poverty alleviation policies. Okay, can we move to the next one? Hello? Hello? Can we move to the next slide? Hello? No, no.
Sure,
Sir, we are on the next slide.
Huh? Okay, we are already. So now I will, talk about the multidimensional poverty, the poverty and capability deprivation. In practice, basic needs approach is extensively used to measure poverty. As we saw the review of the Indian poverty studies, most of them, they focus on basic needs approach. This approach, championed by Roundtree in 1905, identifies the poor if they suffer deprivation because they cannot consume essential goods and services they require for their living. So we have called the basic needs approach. The people can suffer deprivation in many other aspects of life beyond those defined by the basic needs. So the capability approach, the capability deprivation approach is more general than the basic needs approach, because basic need approach focuses on only some kinds of, it focuses on ill health or living conditions and all that, but basic needs approach goes much beyond that. So higher a person is, the greater is their command over commodities. So entitlement to the consumption of commodities includes services provide people with the means to lead a better life. However, entitlements of commodities and also services are only means to an end. So people can suffer acute deprivation in many aspects of life, even if they possess all the means. Thus, we cannot define poverty in terms of means only. The poverty must incorporate capability failure. And that is what my message of this lecture is, that we have to capture deprivation in many dimensions of poverty. So one critical question arises: can we describe poverty purely in capability deprivation? Suppose the richest man in the country suffers from, incurable disease, which prevents him from being functional, suffering immensely. People can suffer, the rich or poor, both can suffer deprivations, because rich can also get, all the chronic diseases and morbidity, chronic diseases and so on. They can suffer, but they cannot be called poor. So a richest person, he may be suffering deprivation. Supposing the richest person, he gets into accident and he becomes disabled and he suffers. He cannot function in the society, but we cannot call him poor. So I make the distinction between capability deprivation in general and capability deprivation caused because of the poverty. So let me give you an example that that suppose there are two persons, A and B. Person A, they keep fast because of religious reasons. They keep fast once a week or so. And then both two persons are supposing malnourished because they are keeping fast, they are not eating enough food. But A is malnourished because he or she cannot afford to buy the sufficient food. But other one, who is keeping fast and malnourished because of religious beliefs, we cannot call that person poor. So both are suffering malnutrition, both have capability deprivation, but we cannot call one poor and another non-poor. We can call one poor and another non-poor. So the message is that if deprivation is caused because of the lack of resources, a lack of means people have, a lack of entitlements people have, then it's an issue of poverty. Otherwise, it is not an issue, it's a deprivation in general. Okay, so this is a distinction I want to make. Many income-rich persons suffer or even die from obesity because they have a poor lifestyle, eating too much rich food and doing no exercise. We cannot call such persons as poor, even if they severely suffer deprivation because of their obesity, because they are eating too much and they have too much money, too much resources. Okay, can we move to the next one? Okay, so I'll continue with that. And recently, as you must have heard, that Princess Kate Williams of Great Britain, she has been diagnosed with cancer, and it is causing her enormous suffering, not only for her but also for her family. So she is going through the painful treatment, but surely we cannot call her poor, even if she is suffering immensely. Or even King Charles, he's suffering from cancer, but we cannot call King Charles as poor, because he is suffering. So the distinction is very important in my view, that capability deprivation in general is different from the capability deprivation which is caused because of poverty or because of lack of resources. Give you another example, that India's capital, New Delhi, is most polluted in the world, as you must be knowing that. Its rapid economic growth has generated so much affluence of Delhi people that people have too many cars, driving on inadequate roads, and little traffic regulations. Consequently, large proportion of population is suffering from many chronic disease because of pollution in Delhi. Now, so there is a deprivation. People are suffering. They are deprived. But that's not the issue of poverty. This is the pollution you have in Delhi. It's not an issue of poverty as the diseases people have. It is the issue of affluence. That affluence is causing the deprivation. Okay. So one needs to make a distinction between poverty and capability deprivation in general, where the host of factors may cause capability deprivation. Poverty must only be concerned with inadequacy of command over resources needed to generate socially determined basic capabilities. A person may suffer capability deprivation, but may not always be poor. So defining poverty from the capability perspective cannot be done independently of income or available resources to individuals. Now, this aspect to me is very important because, as I made the distinction between capability deprivation in general and capability deprivation caused because of the poverty. So this distinction is very important, but poverty literature has completely ignored this distinction between the two. There's no discussion now in the literature, and I am the only one who raised this issue a few years ago, and I had exchange with Sabina on this issue, which is published now. But the distinction which I made between poverty and capability deprivation, nobody is referring to it, although it's published in that Poverty Center Institute. So it is this is a thing important to me, that poverty is different from capability deprivation. Okay, I mean, poverty occurs when capability deprivation is caused because of lack of resources. For instance, I was talking about Bollywood movies. Then the parents, they are dying, and then they don't have money to have access to doctors and medical services. So they are suffering and they are dying and all that. But so that is definitely those stories are told in Bollywood movies also, that poverty is different from capability deprivation. But government can play a crucial role in providing health and education services, particularly to those who have low incomes. So well-targeted government programs can have a significant effect on reducing capability failures, because government can provide means through social programs to the people so that they don't suffer capability deprivation, or they suffer less when they get the means from the government. So government can play a critical role in reducing multidimensional poverty. Okay, next. Okay, so now I want to come to essential capabilities. What are the essential capabilities? Because that is the first step when you are measuring multidimensional poverty. We should specify a set of essential capabilities that everyone in society must enjoy. Okay, they suffer poverty if they do not possess means to enjoy the socially determined essential capabilities. Okay, so number of socially desirable essential capabilities called dimensions of poverty. And basic needs approach may be considered narrow because it focuses on consumption of goods and services that are essential to meet people's basic needs. But capability approach, failure approach is more general. So, but question is, how many dimensions are sufficient to capture multidimensional aspects of poverty? Now, let me mention on this that when I was at the Poverty Center in Brazil, we organized a conference on multidimensional poverty, many dimensions of poverty. And then we edited 2 books about that. And Sabina contributed a chapter in that book, which was edited by myself and Jock Silver. And she, that chapter was very nicely written. And she provided the methods of finding out the essential capabilities. Okay, so I commend her work on that she did when I was at Brazil. Now, so she will know how many dimensions are sufficient to capture the multidimensional aspect of poverty adequately. Now poverty is multifaceted reflecting the deprivation people suffer in many aspects of life. So how many dimensions are sufficient? She gave some requirements, some conditions, that these are the conditions should be satisfied to get the essential capabilities. And this issue also sparked a sharp exchange between Nussbaum and Sen, providing no agreement on the list of capabilities. Should the capabilities, essential capabilities, be different for developing countries and developed countries? So there was no consensus emerged. In the book, in that the point out that we pointed out, me and my co-author, that list of essential capabilities required value judgments on how society prioritize different capabilities. The issue must be debated, when you are finding out what are the capabilities, the essential capabilities. It must be debated intensively, taking account of all diverse views from all social and political groups. And these priorities may also rely on the country's economic resources. So this is the way, this is the issue of value judgments. What are the things important for a particular country? The essential capabilities will differ from country to country. It depends on their means and looking at in what capabilities, deprivations that the country is suffering the most. So we should focus on those capabilities, the essential capabilities. But although there is no universal consensus on these essential capabilities, it may still be possible to agree on some basic capabilities. Some examples are that persons must be well nourished, adequately clothed, sheltered, and have adequate amenities such as electricity, drinking water, sanitation, and so on. In addition, they should have access to basic health services available to avoid preventable morbidity and death, and get sufficient education to function in the society. So these are some basic capabilities which can be used to measure multidimensional poverty. And also I want to point out that essential capabilities may change over time because of technological innovations. For instance, say smartphone, iPhone. Now iPhone has become an essential commodity, essential thing for functioning in the society. Because if you don't have an iPhone, I think you cannot function in the society nowadays. They have become so essential. So that is also, you have capability deprivation if you don't have smartphone. Okay, next. Okay, I want to make now distinction between outcome and outcome indicators. Now, multidimensional poverty is concerned with the failure of basic capabilities. So we can have two kinds of capability indicators: output indicators and outcome indicators. Output and outcome. This distinction is very important. For instance, access to healthcare services such as prevention, diagnosis, treatments of diseases, and management of illnesses are outputs, where life expectancy is an outcome. Because life expectancy, that over a long period, if you have outputs, if you have access to medical services, then it will impact the life expectancy at birth. As access to medical services improve, then it will have impact on the outcome. So people's economic resources or means or income directly impact the output through their income resources are the resources that are provided by the government through social programs. Yeah. So they can, when you are making a policy, you can only generate output indicators. Outcome indicators are different, because outcome indicators are impacted by several host of factors. Okay, maybe that output is one of the factors which can impact outcomes. So we cannot really directly impact the outcomes, but we can impact the outputs. So financial life expectancy at birth is derived from mortality rates in different age groups. Now, mortality rates are influenced by several health-related individual factors, including genes specific to individuals, age, access to healthcare, lifestyle, and many other factors. Okay, so we have no control over outcomes, but we do have a control over output indicators, because output indicators requires the means and policies by the governments. So when we are measuring poverty, what indicators should we use? This is a critical question, whether one should measure multidimensional poverty by outputs or outcomes. The literature has not addressed this issue. It may be intuitively attractive to use the outcomes because they are the ultimate achievements. Outcomes are the ultimate achievements of any society. But if the society's objective is to monitor overall progress in well-being, then it would be appropriate to use outcome indicators. If you are looking at the long-term progress in achieving well-being. But in contrast, multidimensional poverty occurs when individuals suffer ill-being due to their inadequate entitlements to the resources to enjoy essential capabilities. The resources entitle people to generate outputs that enhances their capabilities, particularly those with low incomes. So means are used, policies, government policies are the means provided by the government through social programs and all that. We generate the output indicator, outputs. And then output can impact the outcomes, but we cannot directly impact the outcomes. It has to be through outputs, So outputs
Professor, can I request you to speed up? We've spent 1 hour already. Can you speed up a bit? Because I will have to leave after half an hour. So, but I'll hand it to Charan. Yeah.
Okay. So distinction between output and outcome indicators is very, very important. That's what has been neglected by the literature, and we have to, define multidimensional poverty in terms of the outputs and not outcomes. But if the capability indicators are mixture of both outcomes and outputs, then we cannot aggregate them into multidimensional poverty. You will get a biased results. Okay. So can we move to next slides? Okay. Can we move to the okay. Now, World Bank defines poverty as a pronounced deprivation and well-being, only well-being. They don't talk about the outputs or means to achieve those outputs. So World Bank definition of multidimensional poverty is deficient. So output should be designed so that the persons are well-nourished, adequately clothed, sheltered, and have adequate amenities such as electricity, drinking water, sanitation. All these are output indicators. Now, let me give you an example that if you compare the US and Australia. In US, they spend per capita basis, US spends about more than twice on per capita basis that Australia spends on medical services. But if you look at the outcome, life expectancy in Australia is about 5-6 years higher than that of the USA. So which means the USA delivery of health services is not very efficient. They spend twice as much amount of money, and outcomes are much inferior to Australia. There's a difference of 5 or 6 years of life expectancy is birth between USA and Australia. So also Australian system, the delivery system is more efficient and quite accessible by the most of the people, because we get a Medicare card and then we can use it to get access to all the medical services. So if dimensions, of the, if essential capabilities are mixture of outputs and outcomes, then aggregating to a poverty index will be biased. Next. Okay. Let me now speed up the global multi-dimensional poverty index, that was UNDP's global multidimensional poverty. I think this is quite well known. I don't have to discuss it, but it's a dual cutoff point. That one cutoff point is defining what the deprivation is for each dimension of the poverty, and then they calculate the deprivation score. And deprivation score, if it is greater than 33%, then you are multidimensionally poor. So in this, the UNDP's global multidimensional poverty, it has 10 deprivation indicators. The three dimensions: health, education, and living standards. And all three are given weight, ad hoc weights. The three of them are given ad hoc weights. And then they calculate the deprivation index. Now, interesting is that undernutrition is calculated by body weight index. That in Indian poverty studies, we found that we look at the calories, the calorie consumption, whether the food you eat, whether it is food has enough nourishment or not, in terms of calories, proteins, and so on. So that is an output indicator, but body weight index is not an output indicator. It's an outcome indicator, because people vary. The people may eat same calories or same thing, but people's metabolism varies, and so some people may metabolism varies, and therefore there are many other factors which determine the people's body weight, right? So it is an outcome indicator. Which is actually body weight index is an indirect measure of undernutrition, but it is not an output indicator. So the poverty has a direct impact on people's living conditions, which can be regarded as output indicators. Therefore, the 6 indicators of living conditions in UNDP's global poverty indicators, they are a mixture of both outputs and outcomes. For instance, infant mortality rate is measured by death in the family in the last 5 years. Now, the death is an outcome. We don't have any control. The death can occur in a rich household or poor household. We have no control over that, right? But we have a control whether household has an access to medical services, which can prevent the deaths. So So this is the problem I have with these indicators, 10 indicators which are proposed in Global Poverty Indicator, UNDPs, that they are mixture of output and outcome indicators. Okay, so let's move on to the next one. So we can get the biased results of that. Okay, next. This is the methodology which they use in calculating the deprivation index. So let's skip that. Next. Next slide. Okay. Okay, now, so this is the global poverty indicator, that what you give is that you give weight on ad hoc basis to every indicator or every dimension. For instance, health gets 1/3 of dimension, education get 1/3, and the living standards get 1/3. So when you are giving, which means that health and education, for instance, society gives equal way importance to health and education. I mean, which is, I cannot understand how can you have to have a trade-off between the two, which means that, say, 1 year of, extra education, you have to trade off with 1 year of your life. I mean, that doesn't make sense to me, that when you are talking about, giving equal weights to education and health services, So the weights are ad hoc, and I don't know, there's no sensible way of making these weights, how to determine these weights. Nobody knows how to do it. There's no conceptual framework of finding out the weights. All are ad hoc. So that's why the Alkire and Foster, they wrote a paper, seminal paper in 2011. I think they were worried about the weights, that ad hoc weights, So what they did was they created the counting methods of measuring poverty. A counting method comes from the two concepts. One is the union approach and intersection approach. So union approach is that when you are deprived in at least one of the capabilities, you are deprived in one dimensions of the poverty, one indicator of poverty. But intersection is that when you are deprived in all indicators of poverty. So these are the two, interaction approach and union approach. So Alkire and Foster, they recommended an intermediate approach, that if you are deprived in minimum of K indicators or K dimensions, then you are poor. So they introduce an intermediate approach. Now here also I'm not very comfortable about the intermediate approach. First of all, when you have intermediate approach, you are giving weights, equal weights to everybody, every dimensions. That is one problem. And another problem is that that K, when basic idea, fundamental idea is that you select exogenously a set of M dimensions or M deprivations, M kinds of deprivations, and then you cannot say that some people suffer minimum of K and intermediate of fraud. You cannot change that, that it's like a poverty line. When you have a, fixed poverty line, then you can measure the poverty. But when poverty line is changing, from person to person, then you cannot measure the poverty at all. So same thing is here, the intermediate approach, the minimum of, they have a K dimensions, you are suffering K and more, then you are poor. So you can be suffering in K is equal to say 2. So you can suffer in 2 dimensions or 3 dimensions or 4 dimensions. That I cannot accept that, that there's a difficulty here, that you cannot change it, that you have essential capabilities are fixed for everybody. You cannot change from one person to another person. So that is the problem in this Alkire and Foster's approach of intermediate approach. So next, what should we do about it? Can we move to next slides? I'm about to finish now. Okay, I have talked about it. We can go to the next one. Next. Okay. Now, let me now move to the Niti Aayog's approach. Actually, Niti Aayog's approach, it says that it has adopted Alkire and Foster's approach, but it hasn't. What it has, it has because in UNDP's approach, global poverty index, what you do is that you have a deprivation score. You give the weights to every dimensions or every indicators, and then you calculate the deprivation score. And if deprivation score is greater than 33.3%, then you are poor. Otherwise, you are not poor. Now, so exactly the same procedure has been adopted by Niti Aayog in defining their poverty, but they say that it is, they are following the approach of Alkire and Foster. I mean, Sabina is here; she can confirm that two approaches are different. That the Alkire and Foster's approach is on counting the dimensions, number of the dimensions, the minimum k. They determine the value of k. So there's a difference between the two. And another thing is that it's interesting that that UNDP's Global Poverty Index is an international index. That they determine, say, 10 indicators, 3 dimensions of poverty: health, education, and standard of living. They determined the view of calculating for the global, finding a global poverty indicators. But in India, when we are working on India, then Indian priorities are different. The Indian indicators should be different. That what are the things India should give priority to. So they should have chosen the different indicators, but they didn't. They more or less selected the same indicators and UNDP selected. So that why they did not invent their own indicators which are consistent with the priorities of India. That what are the deprivations which are very important to India. For instance, I see that India hygienic conditions are very bad. They're pretty bad compared to many other East Asian countries. So, and diseases, that the people suffer illnesses and diseases in India, many diseases, and nothing is mentioned in their list of indicators. So that is the problem. And multidimensional poverty, they adopted, that giving ad hoc weights to every indicator, every dimensions, ad hoc weights, and we cannot justify conceptually or theoretically. Okay, so these are some of the conceptual problems involved in the Niti Aayog's multidimensional index. Can we move to the next one? So what we do, how do we measure multidimensional poverty then? Can we move to the next one? So what we do is, supposing there are M, here I have taken the K. Supposing there are K basic essential capabilities which everybody must enjoy, right? And then I'm saying that I discussed that we should focus on outputs, not outcomes. Okay, so outputs means that access to health services, access to educational services, access to clean water, drinking water, access to electricity, and all that. So we can find out the cost of all these to the individual, out of pocket costs, Let's say individuals, I mean, health, you don't have to go every indicator, every indicators of health, we don't have to specify. What we do is that we should have access to health services, all health services, as we have in Australia, that we are given the Medicare card, and then we get access to all the health services. So that is an output indicator. It's not the outcome. Outcome we have no control. Outcome, death can happen, diseases can happen. We have no control over that. So when you are measuring the poverty, we should focus only on output indicators, like developed countries, Australia is doing, that provide health services, government provides, there is some out of pocket, some small amounts, but more or less everybody in Australia has access to health services. Our health have access to educational, the compulsory education, primary, secondary, they are free in Australia, so the children have access to all those services. So what we do we have to find out the cost of services. Some of the costs may be out of pocket, which we must include in the poverty line, right? So we developed a poverty line which meets the basic essential capabilities. So, and then you look at the household income, and then find out whether household has enough resources to meet these outcome indicators, they have access to education, health, and other services, nutrition and so on. So this is the approach which doesn't require ad hoc weights. We just look at the cost, and costs are available. For instance, health services, access to health services. Even in India, they are available. For instance, that insurance, the private companies, they private insurance for health cover, to cover health. They tell you how much is the cost to get a cover to so many these medical services. So why don't we look at the cost, all these costs, rather than looking at the death rates and life expectancy at birth and so on and so forth. What we need is the access to health, education, and other amenities. So this is the way I'm thinking about that multidimensional poverty can be measured just by finding the money metric cost of accessing different services, and then we can measure, then apply, head count ratio, or, poverty gap ratio, and so on. We can do the same thing. So this is much easier. We don't have to have weights, ad hoc weights. We don't have to have a dual, cutoff points, one for every deprivation. You don't have to do all that. But we need to have household surveys to measure poverty. For instance, how can you measure poverty without finding out the economic situation of the households, and without without using the surveys? For instance, national sample surveys, India had, very advanced surveys they used to do, and very good quality at the 50s and 60s. National sample surveys were very well thought, designed surveys, and we could measure the poverty from these surveys. But these surveys seem to have disappeared now. From 2011, there's no good national sample surveys. The quality has gone down, and nothing has been done about to improve the quality or improve the number of the indicators in national sample surveys. So that is why they are moving to multidimensional poverty, where they are using the health surveys and others, which do not give you information about households' economic situation. So this is my main, idea, that you can avoid all these ad hoc assumptions. You can avoid all the weights and cutoff point, dual cutoff points, and all that. We can avoid all that and just calculate the cost of access to these services. And this is what is important, and this is what happens in countries like Australia, that where you give the excess and then you don't have to worry about every indicator, death rates, infant mortality rate, and so on. Okay, I stop it now.
Thank you. With that, let me, given the shortage of time, let me call on Professor Sabina Alkire to make her comments. If she's still, yes. Professor,
Okay.
over to you.
Thank you so much. Really, it's an honor to be here. And I must say, it was in that conference that Professor Kakwani mentioned in Brazil that my interest in multidimensional and being around all of the people who contributed, learning from them, I was just like a sponge. And it was really very impactful. And I'm very grateful for that and for future or subsequent interactions. But it really it was the start of a journey for me intellectually. And I did it having just tried to work and measure multidimensional poverty and capabilities with the Center for Development Studies in Trivandrum. So I really appreciated this paper, and I have been listening very, very keenly. And because time is short and there are many people on the call who I'm sure have greater knowledge about many of the aspects, I'll be relatively brief. But that's not a lack of interest and desire for ongoing engagement. Historically, you will be much more of an expert, and so I will limit my comments to the sections on multidimensional poverty. And I think that we both, in an imperfect way, have also tried to draw on the capability approach in thinking about how to improve measures of multidimensional poverty. And we are all constrained by data. And so I would recognize very much what Professor Kakwani said about the outputs, the outcomes, that they are not all in the same space of functionings. So Amartya Sen in 1979 said that in addition to identifying the poor and aggregating information, we must choose the space in which we will measure. And ideally, from a capability perspective, in my view, we would have capability or functionings because we can measure those. We cannot measure capabilities, strictly speaking, as Andrea Brandolini and others have established. But a radio is not a capability. It is a general purpose means that proxies a capability, and it is included, therefore, in a measure because it is a proxy and because we don't have better data. To give a concrete example, we would like to have a person who has shelter from the elements, but there would be some situations in which the housing materials that would provide that functioning of adequate shelter from the elements would be different in different climatic zones of a country. And they might therefore reasonably have different standards of the actual housing materials that are considered adequate because the overall functioning is the variable of interest. And so where it's possible, and it's not at a global level, to use more specific information that enables us to use existing data to proxy functionings, I completely would want to do that. I think that if I can try to pinpoint three things that might be points for an ongoing conversation, where I'm sure I will learn. One is about the conversion of resources versus using resources as a necessary condition to divine poverty. A second would be relatedly then thinking of the cutoff and the cross-dimensional cutoff and what it might permit in terms of the capability approach. Before doing them, two very small points of details. If you use Bourguignon Chakravarti's or Tony Atkinson's union approach or intersection approach, actually there are no weights. If one dimension was, they're strictly positive, but they can be any weights. So one could be infinitesimally small, one infinitesimally large. But so long as a person is deprived in any by the union approach, they're poor. So long as a person is deprived in all by the intersection, they are poor. And so the union and the intersection, which were very popular prior to our work, actually avoid the issue of weights. They don't avoid problems because then every indicator that comes in deeply affects the measure. And so there are different problems with the union and intersection approach in that one new indicator can completely change the results. It's not necessarily robust, but that's a different problem. Our approach minimizes that disruption from a new element, but does require the setting of weights. And we address that by robustness tests for a range of plausible weights following Sen's suggestion, but I'm sure it could be improved. The second is that you correctly pointed out that at the level of language in 2011, James Foster and I used the word dimension. But later on, and in our 2015 OUP book, we changed that to indicator. And we did that because many countries in practice want to group indicators into conceptual dimensions that are not in the empirical or the theoretical work. But that has created a confusion. But because of that change of language, I would say that when it comes to the methodology, the UNDP Global MPI or the Niti Aayog MPI, that uses the word indicator is actually using the underlying term dimension that we used in 2011. We've just had to go along with the more up-to-date language. And so that is a confusion in the published work that I acknowledge, but it's not a difference in methodology. I think the key question I have, and we will all know this, is that one of the insights that Sen very much pushed into our consciousness was the differing ability of people to convert incomes into resources. And for that reason, the fact that the same income, the same resource bundle, may have very different abilities to create outcomes. So if I read briefly a quote from Inequality Reexamined, chapter 7, he says the basic failure that poverty implies is one of having minimum adequate capabilities. And consider an example of a person with a high metabolic rate or large body size or a parasitic disease that wastes nutrients. He or she is less able to meet the minimum nutritional norms with the same level of income compared with another person without those disadvantages. And so Professor Kakwani's proposal is to take the capabilities or functionings that people must have and identify the reasonable income that's required and then set that. And I wasn't clear if that was going to be set at the household level and if it could take into account people's different abilities to convert income into resources, because I think that that's one of the challenges of having a resource-based approach. The second challenge would be if I live in a household where my big brother is an addict or there are intra-household family problems, and so they have adequate resources to cover everybody's needs. But because of addiction, because of abuse, because of different norms, some people do not have their wheelchair, do not have their extra needs met because the funds are used elsewhere. A many metric approach would say that everybody in that household, including a disabled child, has enough. But from an output or outcome perspective, there would be a child without a wheelchair who couldn't move around because the money was used in other ways. And so that would be a question that I'm sure you have thought about, but that came to mind in listening to your presentation. And the last point I wanted to make is again, it's coming back to theory because I'd really like Professor Kakwani's input into this. And it's going back to Patnaik and Zhu and their debate with Amartya Sen about how to theoretically represent capabilities and capability freedom. And at some point, as you would remember, they said that you can count the number of items in a set, a union approach. And Sen objected vociferously that if one of those items was the ability to be beheaded before dawn, then having that possibility in your set did not improve your freedom because that was not valued. And so a question that I have is about a union or intersection, and something that Professor Kakwani said is that you're considering capabilities that everybody must have. But in the starving versus fasting example, it also might be that a poor person who was not nutritionally deprived wanted to fast. And so how do you recognize that we have a very imperfect way, but theoretically we are drawing on Patnaik and Zhu's proof of independence. And this is in our chapter 6.1 of our book. And we're saying that the assumption that a multidimensional poverty measure is making is essentially that at the individual level, if a person does not value a capability, then they can opt out because there's a cross-dimensional cutoff and they would be deprived in that, but it would not constitute poverty. But then the corresponding assumption is if they have a critical mass of deprivations, then we are assuming they are not valued, they're not self-chosen, it's not fasting, it's not a self-made millionaire who's not gone to school or homeschooling or whatever, that it's poverty related, which is a very problematic assumption. But it's that theoretical link of the poverty cutoff and this need to retain a sense of freedom and not just count the capabilities given the individual preference functions that we've tried to link to, just drawing on and extending the Patnaik and Zhu proof. So that were my very brief and appreciative comments, and I really look forward to ongoing discussions. Thank you so much.
Thank you. I don't know, Professor Kakwani, do you want to respond immediately or should we move on?
I can respond. Yeah, maybe I can respond. You know that.
No, you don't have to. But
yeah. Let me respond very quickly. That counting approach basically derived, the intermediate approach between interaction and union. Now, even in interaction and union, you are assuming that all indicators or all dimensions have same weight, exactly the same weight. You can change the weights, but that has to be ad hoc, that some, I mean,
So
for instance, supposing you have a health and education, right? You are not giving weights to them, but you are treating them, that, at least, one dimension, that you are deprived in one capability, at least in one capabilities or in all capabilities. So you are giving equal weights, more or less. You are not giving actual weights, but the implicit weights are equal. Okay. And
I wouldn't accept that, but I will listen.
okay, let's. Yeah, I see. So let me move on now. I really have to move on. This academic debate has been quite fascinating. So I want to just give a little bit, I've been involved in government for I don't know how many donkey's years, decades. So let me give a little kind of perspective from the ground, So education, health, we have been discussing for years and years. And in the 1960s, we set up, every state basically set up primary health centers, secondary health centers, primary schools, secondary schools. The idea in India was that both basic health and basic education would be 100% provided by the government to every citizen who needs it. Now, when I look at that issue, what I see is a failure of government. What the academics see is an index. This is the perspective. I'm sorry, I'm not trying to be kind of negative. I think the theoretical perspectives are important for us to be clear. But where does this lead? So I'll give you a very specific example. When I started studying child malnutrition, I came across, so I said, why is it? First, you discover that the huge variation when you run it against per capita GDP, it's not related. It has nothing to do with income. Across states. When I look at it across countries, I find a huge gap in India. So I say, okay, what is the problem in India? So I discovered something called environmental enteropathy. in 2006 paper, I noted this problem. And the question was, what do you need to do to solve it? So people just didn't believe it. They'll believe malnutrition means poor nutrition. There's a whole series of papers now connecting it to open defecation, connecting it to lack of toilets, and most recently a paper published this year in an international journal, which shows that in areas in India where there is poor nutrition, poor sanitation, nutritional supplements have zero effect, zero. Okay, this was a trial which was done in parts of India, a comprehensive by a person who's done tons of studies under MIT banner, and if you go to areas where there is no sanitation issue, then nutritional action has the normally expected effect. So what does that prove? Proves, I think, very, very conclusive. Things which people have derived in India and all over the world since around 2000. Spears and others have done this research. And so the problem from my perspective is sanitation. That is the answer I come to. Okay. So my point here is that health and education are not new problems. So the focus should be, we have public goods, we have quasi-public goods. It is the government has taken over this whole issue. And the issue to me was, why are they not performing? The issue is not whether there's poverty or not. The issue is, why are they not performing? Anyway, I just want to leave that for the general audience and turn to questions. Charan, I'm going to have to leave in 15 minutes, but I'll stay for 15 minutes and let's open it for questions. And,
Sure.
and very brief comments, right? There's very little time left.
Right. There are a couple of questions in the chat box, or we can open to audience. There are a good number of people attending. If they raise their hand, we can ask them. I thought the question before anybody comes in, which I can read. Capabilities are mostly qualitative and include many indicators that are unrelated. So that could be one. And then I think Syed is raising his hand.
Yes, Mr. Syed, you can ask your question. I don't see on the thing, but it must be here somewhere. Charan, nothing is happening. So let's, okay, Dr. Vishan Das, you have a question? Can't hear you. Mute. Unmute.
Thank you very much, Mr. Chairman and the speaker, sir. Sir, my one very basic question, is the poverty, is a geographical poverty? For example, if a person is a cobbler, he is working in a village, he is poor. But if the same cobbler is working in Connaught Place in New Delhi, he earns 1,000 rupees a day, maybe more. So have you considered that aspect when the poverty, I mean, just an example, and to geographical poverty? Same function, same skill, same job, but then you earn differently from one place to another. Your comment, sir.
Yeah, I think that's a very interesting question. That if there's a cobbler in the village, right, there the demand for that service is very small because people don't have enough money to pay to the cobbler. And also the price levels are very low. Whereas if you go to Delhi, the cost of living is very high, but people have a lot of money also, and then they demand, So I think Tendulkar made this point in his, approach that we should make adjustment to the poverty by over time as well as across the regions and across the areas, that spatially and over time, So he made that point that we must take into account the spatial price indices in calculating the poverty between rural and urban.
Thank you. What the Tendulkar poverty line has indices, separate indices for for states, but not below that level. That is the factual position. Okay, next question.
Yeah, okay.
Any Sharan say, Dr. Sharan?
In the chat box, I thought this was a
Me.
good question. The fundamental question is poverty analysis, why is one poor, which is all about analyzing poverty as a process. Here, the concept of capability importance. And I think the community thing becomes important because there are communities which are poor. Assume them on the capability deprivation of an individual because of absence, suboptimal nature of the enabling role of
I think the
community.
voice is breaking. I can't understand. The voice is breaking a little bit. you know.
Oh, this is at 4.16 Bhagirathi Panda. I can read it.
Yeah, okay.
Question in poverty is basically an analysis about the capability. And therein he brings in the story of individual and community. And he says, what is your take on the capability deprivation of an individual because of absence, suboptimal nature, the enabling role of the community?
Not. Can you repeat the question? Let me try to understand your question. Huh? You are talking about the community level poverty or something.
Yes. And
I mean, idea is the same as the community or individual or household or individual level. The capabilities, for instance, access to health, access to education, access to, clean water, access to hygiene and all that, So these are the capabilities which are applicable to every individual or household or communities, or even state level or rural and urban. So the idea is the same, isn't it?
Good.
Am I,
Can I, sir?
am I clear about it?
Yeah, this question.
Mr.
was-
Panda, yes, question.
Yeah.
Mr.
Can I
Panda.
yeah. The basic question is, the fundamental question is in poverty analysis that why is one poor? So which is all about analyzing poverty as a process, not as a situation. So here the concept of capability, whether individual or community, assumes importance. What is your take on the capability deprivation of an individual because of absence or suboptimal nature of the enabling role of the community?
Thank you.
Mhm.
Thank you, sir.
I mean,
Any other?
maybe, I mean, when you have a communities, supposing in a village community or wherever you are, I mean, they share the resources, right? I mean, they have, that some capabilities, they have a, public capabilities and private capabilities, So public capabilities have to do with the, communities, that communities, they, have some kind of, system or some capabilities they provide communally, So that way you have you can save a lot of money, that you can provide public goods. Public goods, that when people can share the public goods, and that will be more efficient way of providing, capabilities to the people. So communities can be very important, depends on how they provide the services. I mean, in the village, there are some services community can provide, right? And they can have, access to capabilities with minimum of cost. The cost becomes very important when you are providing the services at community level. For instance, the government level, if government is providing services which are people are sharing, are getting access to that, that is more efficient than if every individual creates his own capabilities, their own services, then it becomes very expensive, right?
Thank you.
So
Yeah. Okay, Charan, is that it? Should we? Yeah.
I think we
Okay,
should.
let me thank the speaker, Professor Kakwani, and the discussant, Professor Sabina Alkire. I'm not sure if she's here, but if she's left, can convey. And thank you for all the participants. They've been very patient, actually. I'm surprised, but many of them have remained for 2 hours, and I really am very impressed. So, Professor Kakwani, you really drew a good audience, and they've stayed with us. Thank you, everybody, and over to you, Charan, to conclude.
Thank you very much, first of all, Professor Kakwani, to have agreed to come and speak and prepare a very elaborate talk, which reminded me of my academic days when I was your student. Thank you very much. And Professor Sabina, I have no thank you. Early morning, and you did at such a short notice. Really want to thank you, Professor Kakwani and Professor Sabina. This is, of course, so Professor Sabina, your second time, but Professor Kakwani is speaking to us next week, also Friday, same time. Dr. Arvind Virmani is also going to be chairing the session next time, and I want to thank him today for being with us throughout an extended delayed time, but he's agreed to kindly stay till the end. I want to thank him. And I would like to invite all of you for the next week's talk, where Professor Kakwani extends this discussion on poverty. And we'll all benefit, and as you've seen today also, very professorial style, starting from the basic and taking us into the latest. That's Professor Kakwani's style, and that's what we had noticed even in 19 when he used to teach us at the university. Same thing, seen it demonstrated even next week. So I'll invite all of you next week on Friday, same time, for a discussion. Dr. Virmani chairs, and Dr. Bala will be the discussant for the next week. Just a very quick announcement. EGROW Foundation is attempting to spread financial literacy. So every we have a class on some or the other macroeconomic issue which is being discussed by experts. Our charges are very nominal, which we waive if somebody wants it to be waived. We invite all of you to become part of that exercise. It's sort of a holistic exercise which we are doing. Please spread the word. We would like to train as many as possible PhD scholars, academicians, young policymakers to join us, and even aspirants for civil services to join us in that pursuit of financial inclusion, which we are trying to offer every evening 7:30 to 8:30 p.m. With that, let me conclude and thank each one of you and invite you for the talk next week. Thank you.
Thank you.